Welcome to the Deep Dive. Today, we're tackling a really important topic, understanding the essentials of breast health.
Yeah, really vital stuff.
We've got a medical overview here looking at breast assessment, and our goal is pretty straightforward, right?
Absolutely. We want to pull out the key info for you. What's normal? What might be a red flag?
The value of self-exams and, how things change over a lifetime.
Exactly. Just the must-know points.
Okay, let's dive right in.
It's kind of amazing how much you can pick up just by, well, knowing what to look for in a self-check. So where do we start? The typical picture.
Yeah, let's do that. What does healthy breast tissue generally look and feel like? Usually you're looking for breasts that are fairly symmetrical.
Though perfect symmetry is rare, isn't it?
True. Fairly is the key word. And smooth skin, no obvious lumps, no discharge if you're not lactating.
And the nipples.
They should generally point outwards or maybe slightly down, not pulled in. That's what doctors call retraction, like they're being tugged inwards from behind.
Okay. And there's a specific area people should really be aware of, the tail of Spence.
Ah, yes. Good point. That's the breast tissue that extends sort of diagonally up towards your armpit.
And it's crucial because
Because it's a really common spot for changes to occur. So you absolutely need to include that area when you're doing a self-exam. Don't forget the armpit zone.
Got it. And thinking about younger people, maybe teens, development can be uneven.
Totally. Some asymmetry during breast development is completely normal. You see breast budding that's usually around 8 to 13 years old.
Tanner stage 2, technically.
Right, and maybe some tenderness or finding small lumps. These are often benign, just part of the process.
Okay, so that's the baseline. Now, what about things that should make someone think, maybe I should get this checked? The red flags.
These are the big ones. Any new lumps, definitely. Swelling or areas that feel unusually hard or thick.
And skin changes are key too, right?
Yes. Watch out for skin dimpling like little puckers, any redness, or a thickened texture. Sometimes it's described as looking like an orange peel.
Peau d'orange, yeah. And nipple changes.
Crucial. Any new discharge, especially if it's bloody or clear and you're not breastfeeding. Also, a nipple that suddenly seemed to turn inward when it didn't before.
Or any new asymmetry between the breasts or visible pulling of the tissue. Those need attention.
So how do you actually look for these things effectively yourself? Self-exam techniques.
It's more than just a quick feel, isn't it? It involves specific positions.
Exactly.
Yeah.
You need to observe your breasts in different poses. Arms relaxed by your sides first. Then raise your arms straight overhead.
Right.
Then press your hands firmly on your hips, pushing in a bit.
To tense the chest muscles, yeah.
And finally, leaning forward from the waist, letting your breasts hang.
And the point of all this maneuvering?
It's designed to reveal subtle things. Things like skin retraction, dimpling, or asymmetries that you might just miss if you only look straight on with your arms down.
Makes sense. And while we're talking self-assessment, lymph nodes are part of this too.
Definitely.
Yeah.
Where should people be feeling?
The main spots are in the armpit, the axillary nodes. You want to check sort of the central part, the side towards your ribs, the front towards your chest, and the back towards your shoulder blade.
Okay, quite a few spots there.
Yeah, and also just above the collarbone, that's supraclavicular, and just below it, infraclavicular.
And what are we feeling for? Normal versus abnormal?
Normally, you probably won't feel them. Or if you do, they should be small, soft, easily movable, and not tender.
And abnormal?
Abnormal nodes tend to feel hard, maybe fixed in place, enlarged, and sometimes they can be tender or painful.
Okay. The source material also mentioned mastitis. That's related to lactation, right?
Yes, mastitis is basically inflammation of the breast tissue.
Yeah.
It often happens if a milk duct gets blocked or if there's an infection. It usually occurs before an abscess might form.
Symptoms?
Think pain, swelling, redness, warmth in the affected area, sometimes fever and feeling pretty unwell like you have the flu.
But it's treatable.
Yeah.
And safe for the baby.
Oh, yes. It's generally not harmful to the infant. Treatment usually involves rest, warm compresses, making sure to empty the breast frequently by nursing or pumping, and sometimes antibiotics are needed. Usually clears up in a couple of days.
Good to know. Now, if someone does find something worrying during a self-exam, what details are most helpful to get in your doctor?
Precision helps a lot. So note the location. Using the clock face analogy is great, like at 2 o'clock, 3 centimeters from the nipple.
Okay.
Estimate the size, maybe in centimeters. Describe the shape. Is it round, irregular? The consistency, soft, firm, hard.
Right.
Is it movable or does it feel fixed? Is it tender when you press on it? And mention any related skin or nipple changes you've seen, plus anything you noticed with your lymph nodes.
That's really practical advice.
Mm.
Lastly, let's talk about aging, specifically around menopause. How do things change?
It's common for breasts to change quite a bit. They often become smaller, feel softer, maybe hang a bit lower, become more pendulous.
Why is that?
The glandular tissue, the milk-producing part, tends to atrophy, to shrink. And it gets replaced mostly by fatty tissue.
Any other changes?
Nipples might get smaller, less erect. The skin can seem thinner, maybe veins are more visible.
And a really important point here, related to risk.
Well, the risk of breast cancer does increase with age, so continued screening remains vital. And there's an interesting note in the material.
What's that?
It says, a breast lump may have been present for years but is suddenly palpable. The changes in tissue density means something that was hidden might become noticeable.
Wow. So that really underlines the need for continued self-awareness, doesn't it?
Absolutely. Regular self-exams or just breast awareness stays important throughout life.
Okay, so just to recap, we've touched on normal findings, the red flags to watch for, how to look for them, using different self-exam positions, checking lymph nodes, a quick look at mastitis, documenting concerns, and the changes that come with age.
Yeah, quite a bit in a short time. And zooming out, I think the core message is about empowerment through understanding.
Definitely. Which leads to a final thought for our listeners.
Right. How can really tuning into your body, having this baseline knowledge we've discussed, help you be more proactive about your health? How does it help you know when it's time to maybe seek advice?
It's a powerful first step, isn't it? Just understanding these basics.
It really is. A very significant step for your own well-being.